Hi there, Todd Cameron here, GP and Medical Director at M3 Health. This message is for patients of ours that have been determined to be COVID positive. So that sounds a little bit scary, but in the vast majority of cases, COVID, infection with SARS coronavirus 2, actually requires no intervention. So 8 out of 10 patients that are COVID positive will find that they don't require any attention from the hospital system whatsoever. So our job is wherever possible to keep people out of the hospital system that we know will be overworked during the COVID pandemic. So if you have been told you're positive, it will usually be via one of the testing stations will have texted you. Hopefully your GP has received a copy of that as well. If not, you need to urgently make an appointment with your GP to discuss how it is that we're going to approach COVID care for you in the context of your own personal health. But before we do that, a couple of important things. When we know you are COVID positive, you must isolate. Stay in your home, and wherever possible, do not leave. Make sure that you have either friends or family that are not part of your household that can go and do your regular shopping, run your errands, whatever is required. Keep in mind that we want to minimize that. Make sure that you are meticulous with your hand hygiene. Washing soap and water, as you will know, is the best for 20 seconds. Make sure that you are not preparing meals for other people in your household, and in an ideal world you are not caring for others in your household. If you can separate out, you have an extra toilet or bathroom, then ideally the person that is unwell with COVID that we know is positive should use separate toilet and bathroom. That would be the perfect circumstance. Just minimises the likelihood of spread between other members of the household. Make sure you're practicing appropriate social distancing within the home, and use a face mask at any time that you are dealing with other humans, keeping that social distancing in mind. Those things will be really important. It may be that from time to time you need to leave your home, maybe to go and be assessed at a medical appointment. If possible, again, this is not possible for everybody, but make sure that you don't use public transport. Don't use transport that is used by others, such as Uber, etc. If at all possible, use a car that nobody else uses. I understand that is not always viable. And if you do need to be driven in there, then make sure both people in the car have face masks in an ideal world and are washing their hands before and after the travel. Make sure that you have regular contact with your GP so that we can work out the best plan for you to make sure that you remain well through this. In the other 2 out of 10 people, 1 out of 5 that do require hospital admission, we'll do our best to make sure that that's as seamless and smooth as possible, and your GP will be the best person to determine if and when that's appropriate for you. There are other documents associated with the message that you received this on. Make sure you download and read those. We'll be in regular contact with you, and if there's anything else that you need, you know where to find us. I've been Todd Cameron. Thanks for your attention. Bye.